Hello friends, imagine there is an acute emergency and you have made some preliminary investigation and you think it's all normal, there is no emergency. What is likely to happen? Can you imagine that? Yes, this reasoning question is based on such a situation. The question is, if you suspect carbon monoxide poisoning, you should not or you cannot rely solely on pulse oximetry. Why is that? Pulse oximeter or pulse oximetry is a very routinely performed investigation, or it's a routine check. Even in households, this instrument is available. So, why can't we rely on this instrument? Let's find out. Carbon monoxide is an acute hypoxia and it's an emergency. It's anemic type of hypoxia. And we would like to know the O2 saturation with hemoglobin, percent saturation. Normally it's about 97, 98%, and if it goes below 93%, then we start taking urgent steps on it. But O2% saturation is routinely measured by pulse oximetry. Yes, it's routinely done upon arrival of the patient also. Among the first few things, pulse oximetry is done. Now, what is the principle of pulse oximetry? That's the important part here. You needed a technical understanding to answer this question. Absorption of light for different wavelengths in the pulse oximeter. That's the basis or principle on which the pulse oximetry is based. I mean, if it is to detect the oxyhemoglobin, the absorption of light would be different for oxyhemoglobin and it will be different from reduced hemoglobin. So from the amount of absorption of light or the pattern of absorption of light from the oxyhemoglobin in the blood, the pulse oximeter tells you the percent saturation. I mean, how much oxygen, in simple terms, how much oxygen is present and is bound with hemoglobin. So that's the principle. Now consider this. Carbon monoxide poisoning means carbon monoxide binds with hemoglobin with 200 times more affinity and it forms carboxyhemoglobin. It's acute hypoxia because oxygen has been displaced and much of hemoglobin is occupied by carbon monoxide, forming carboxyhemoglobin in the blood. Now this carboxyhemoglobin, this is the most important part. Carboxyhemoglobin has the same light absorption properties as oxyhemoglobin. Yes. So if you are using pulse oximeter and there is carboxyhemoglobin, then pulse oximeter won't be able to distinguish or differentiate between carboxyhemoglobin and oxyhemoglobin. So even if the oxygen has been reduced or it is low and carboxyhemoglobin is high, it's a carbon monoxide poisoning. But since pulse oximetry or pulse oximeter is not able to distinguish between the two, it will give you a normal reading of oxyhemoglobin because it won't be able to distinguish that it's a carboxyhemoglobin because both having the same light absorption properties, and therefore even if it's a reduced if it's a hypoxia, acute hypoxia, emergency, and yet pulse oximeter will give you the normal finding, and therefore in such conditions you cannot solely rely on pulse oximetry. We continue to discuss all such interesting questions, reasoning questions, clinical case based questions on our channel very routinely, regularly. So if you have not subscribed to the channel, go ahead and subscribe now.